Welcome to Module 1 of Health and Safety for Center-Based Educators. This online series includes 4 modules, each focused on a different topic related to health and safety in center-based early childhood programs. This first module provides a brief overview of the regulations, standards, and resources in Rhode Island that govern health and safety in early education and care. The second module explores everyday health and safety practices in child care centers and classrooms. The third module looks at daily supervision and interactions that keep children safe and healthy. And finally, the fourth module discusses what center leaders need to do to prepare for emergencies. Here you see the learning objectives for this series. After completing all the modules, you will be able to demonstrate an understanding of state regulations and standards related to health and safety, demonstrate an understanding of health, safety, and emergency procedures, prevent and prepare for emergency situations, and minimize the spread of disease and prevent potential injuries. It is imperative to have regulations and standards around health and safety in early childhood settings for several reasons. First and foremost, such standards and regulations help ensure safe environments for children. They provide comprehensive and uniform expectations for high-quality programs, and they educate parents, teachers, ECE administrators, and other stakeholders about the practices and policies needed to keep young children safe. We will now describe some of the government and non-government entities and organizations that provide early childhood health and safety regulations and standards within Rhode Island. The Department of Children, Youth, and Families, or DCYF, is the state agency that monitors and licenses center-based and family child care programs in Rhode Island. DCYF enforces laws and regulations designed to keep children in early care and education programs safe and healthy. As a center-based educator, you should be familiar with DCYF regulations that oversee practices in child care centers. You can find the regulations on the DCYF website at www.dcyf.ri.gov. Caring for Our Children is a set of over 600 national health and safety standards and guidelines for early care and education programs. The standards are jointly developed by the American Academy of Pediatrics, American Public Health Association, and the National Resource Center for Health and Safety in Child Care and Education. The Caring for Our Children standards greatly inform the DCYF regulations, and in many cases, the regulations tell you to go to Caring for Our Children for more information. Caring for Our Children is both a print and online resource, and the online version is regularly updated to reflect the latest research on health and safety in child care settings. To access the online standards, visit the Caring for Our Children website at cfoc.nrckids.org. Another organization that oversees the quality of health and safety practices in child care settings in Rhode Island is BrightStars. BrightStars is Rhode Island's quality rating system. BrightStars has developed a framework for measuring quality in center-based programs, including in the area of health and safety. The BrightStars framework incorporates elements of the environmental rating scales, also known as ITERs, ECHRs, and SACRs, to help programs identify strengths and areas for improvement in their health and safety practices. You can learn more about BrightStars by visiting its website at brightstars.org. The Rhode Island Department of Education, or Rhode, has developed its own set of additional standards for child care programs, known as the Comprehensive Early Childhood Education, or CECE standards. These represent the highest quality level for early education in the state, and all state-funded pre-K classrooms must meet these standards. While the CECE standards address all aspects of early education programs, they include specific standards related to health and safety. For more information about the CECE standards, visit the Rhode website at www.ride.ri.gov. This concludes Module 1, which provided an overview of the regulations, standards, and resources in Rhode Island that are related to health and safety in child care settings. For more information, please contact the Center for Early Learning Professionals info line.